Every suicide ends one life, but it rolls a grenade into the lives of many others. I saw this firsthand when I was 7 years old. My grandfather sat on a couch, placed a shotgun to his chest, pulled the trigger, and made his last worldly decision. A short while later, I remember being in that room, looking at that couch, watching my parents, aunts, and uncles, and especially my grandmother crying and wailing like I'd never seen before. I was just trying to make sense of it all. Suicide, it's a captivating, powerful, and an uncomfortable word. Even though somebody in the US dies by suicide every 10 minutes, yet hardly anybody talks about it, unless you bring it up. And then everybody seems to have a story. Depression and loneliness are the main causes of suicide. And in the US, each year, 9 million men, women, and children will be diagnosed with some form of depression. And anybody who's ever been depressed knows what it's like. You can't pull the covers off. It's like walking around in fog and lead boots. Of that 9 million, about 1 million will go on to attempt suicide. And in the US, in 2022, 50,000 people died by suicide. That's the most ever since World War II. Yet the media hardly ever talks about it. Why? I mean, isn't 50,000 people a big enough number to raise some level of concern? Apparently not. I mean, imagine, it's like a 737 fully loaded, crashing to the earth like a lawn dart. Every day, all souls lost. And it doesn't get much better. I mean, in 2022, we also lost more than 100,000 people from overdose deaths. And did you know that more police officers and firefighters die by suicide than in the line of duty, or that suicide's now the third leading cause of death in our young working class adults? And most people don't think about a young child taking their life. But where I used to live in Las Vegas, 18 school-age children did so in 2020, the youngest being 7 years old. Nobody can make sense of that. The mental health crisis has always been upon us. The pandemic just made it worse. But there is some good news, and you can make a difference, and it might just be as simple as starting a conversation. My journey into all this began when I was in medical school. I was always fascinated with mental health and suicide. During my medical career, I've been fortunate to work with notable figures like Gavin DeBecker. He's the author of The Gift of Fear. You might have heard of him. And he painfully lost his mother to suicide at 16 years old. And one day, he asked me, he said, "Johnathan, what do you know about this drug called ketamine?" I said, "Well, I'm a board-certified anesthesiologist, and I happen to know a lot about it." And I answered, "Well, it's an old drug. It's used every day in the hospitals, especially in pediatrics, for its safety, and it's on the WHO essential list of medications." And Gavin replied, "Johnathan, I'm glad you answered my question that way, but I just want to tell you, I was prepared if you had answered my question in another the other way. A little taken back. It's important to understand why Gavin was ready to debate if I answered the question the other way. And it's because when most people think about the drug ketamine, it's either a horse tranquilizer or they think of it as a party drug. And most healthcare professionals only think of ketamine as an anesthetic and not something that can treat depression and stop suicide. When I answered Gavin's question, it was that it could stop suicide. And so then we wrote the Revolutionary Ketamine. What makes it revolutionary? Well, the fact that ketamine can stop suicidal ideations in its tracks. Dr. Thomas Insel, he's an author and the former director of the National Institutes of Mental Health. He once called ketamine the most important discovery in 50 years. Peer-reviewed research shows that even one infusion of ketamine can rapidly relieve suicidal ideations. Outpatient psychiatry clinics are using ketamine now, and in some studies it shows up to 70% relief in suicidal ideations. And when paired with psychotherapy, the results for ketamine are staggering. We've never seen results like this until now. And we've saved the lives of numerous veterans using ketamine. And let's remember, we're now losing 40 veterans a day to suicide. Here are some stories whose lives were transformed using ketamine. The New York Times in 2010, they reported, Dennis Hartman, a businessman from Seattle, quote, "I look at the cost of not using ketamine. For me, it was certain death," end quote. Dennis had been treated for a lifetime of treatment-resistant depression, and he even had a suicide date picked out before he entered a National Institutes of Health ketamine trial. He received the ketamine, and his depression was relieved, and now he receives ketamine as needed. Another story from a Florida clinic is called Olive's story. Olive is a young girl with a lifetime depression of depression, PTSD, social anxiety, and multiple suicide attempts. And at 26 years old, she decided the only way forward to get over her pain was a compassionate euthanasia in the Netherlands. And let's highlight that people who are suicidal desperately want to live. They just see no other way around their pain. So the day she was to leave, a friend talked her into trying ketamine. So she went to the clinic, received the infusions during the week, and she never took the flight. I treated a young man, 17 years old, suicidal ideations, depression, and social anxiety. And after the first treatment, the suicidal ideations got much better. After the second infusion, things were looking much better. His anxiety went down, depression went down, and by the third infusion, you could see he was looking more to his future, and by an active will, he could control the obsessional thinking that had led him to this dark place. And he eventually actually got off of his antidepressants. The theme of tonight is that mental health is more than just the absence of a mental disorder or symptoms. And this is important because pharmaceutical companies would just like to pack ketamine into a pill and then sell it. But I can tell you that this is unlikely. And that's because ketamine treats more than just the biological disorder. It treats the root cause. The experience involves the mind, body, and spirit, dissolves the ego and time, and taps into the human psyche. Ketamine with therapy helps patients process complex emotions and traumas, and gives them hope that things can change. One of my patients who was older and after he received a ketamine treatment told me once that after the treatment, he was able to see his adult self through his parents' eyes, and that he was not a bad person. He should not be ashamed. He spoke of words of acceptance and that a sense of being enough and that everything was going to be okay. I learned young that suicide is a tragedy filled with plenty of drama and pain. And since my grandfather, I've had family, friends, and even professors die by suicide. And I think if I could go back and change anything and maybe change the outcome, would I consider ketamine? That answer is a resounding yes. But understand, ketamine is not a panacea. It's just part of the problem, part of the solution. Suicide is very complex. But ketamine just might be the lifeline that your loved one or yourself needs. And it might just be revolutionary. Thank you.